Republicans hold health care reform hostage. Monday is the deadline, and there is very little progress on either side of the aisle. Tracy Potts is tracking this morning's developments from D.C.
Ted Cruz finally sat down after 21 hours.
This was all about elevating the debate in the public.
It has been a big waste of time.
Now the Senate's on track to pass a budget that'll likely include money for the Affordable Care Act. That's sure to go nowhere in the House. Democrats say they'll fight for it.
Anything that diminishes the Affordable Care Act is not anything we want to support.
We cannot rely on the commander-in-chief to negotiate.
Republicans are expected to counter with a budget that includes more things Democrats don't like tax reform, the controversial Keystone Pipeline, or changes in Medicare and Social Security.
This attitude of my way or the highway doesn't get it.
I don't think it's going to be pretty.
It's still up in the air whether they can agree on a budget before Monday's shutdown deadline. Then Tuesday, another key date, open enrollment for the new health insurance exchanges. President Obama talks about that at a community college in Maryland today. And we're hearing Republicans will likely put health care on the back burner until next month's debt ceiling debate. Tracy Potts, NBC News, Washington.
And uninsured Oklahomans are only days away from signing up for health insurance. Starting October 1st, you can enroll in the Affordable Health Care Act. It's something this small business owner is considering. Chris Dennis and his partner at Wildwood Designs have a debt-free model and put all their money into overhead cost. Well, that leaves nothing extra for health insurance. Now, with the Affordable Care Act, Chris can actually pay as low as $114 a month for insurance. Chris calls it a bargain compared to the $20,000 he's paying from his knee surgery.
It kind of just puts in perspective where your responsibilities lie. So I can't just go out and act like I'm 16 anymore and run around.
Once open enrollment starts, you have until March 31st to get into some sort of plan. And if you'd like to estimate what you would pay under the Affordable Care Act, you'll find a subsidy calculator on our website. Just log on to kjrh.com.
Happening today, the Centers for Disease Control and other medical experts will give us an outlook on what the 2013-2014 flu season may look like. 2 News reporter Patricia Santos is live in the studio with a closer look. Patricia?
Well, the flu season can be very unpredictable, but U.S. health leaders are hoping to get it right this year. We're expecting to get more details later this morning on the type of flu season we may be seeing. Now, last year's flu season was one of the worst in recent years. There were 161 children's deaths, the highest since they started keeping records. There were also a high number of people 65 and older hospitalized. For the first time this year, the flu vaccine will protect against 4 of the most prevalent viruses. Manufacturers have projected they will produce between 135 to 139 million doses of the influenza vaccine. Anyone over 6 months old is urged to get the shot, and if you don't like the shots, there are nasal spray. Now, later today, health experts will give us a better outlook of the types of strains we can expect and what they're doing to encourage the public to get the shot. Now, seasonal flu activity begins as early as October and continues until May. The peak is usually in January or February. Patricia Santos, 2 News, works for you.